I'm a registered nurse, and I represent healthcare on the task force. And my background is in telemedicine. And I've been working with telemedicine since 1994, and through the University of Minnesota programs. And I know that at some point we were reaching out to up here too. So I just can't remember in some of the programs that we've started whether we actually made a connection with you or not. But what kind of programs are you doing for telemedicine? That's really exciting. I'm glad to hear it.
Well, I don't know what programs we really have, but that's all MIS did was provide the network for the satellite clinics to operate. Dr. Chester is in charge, and she has clinics in Huntington, Ball Club, Nina, where else? In those areas.
Okay.
Yeah. So we have towers, and she's able to reach out to Mayo if she needs to. And get say if I was in there in the clinic and they want to read my heart conditions, they can do that with me. And have dialogue between the
So you have some connections with Mayo, and then you have all of your clinics connected.
Yes.
And
Indian Health Service. And then also at one time when I was at Cass Lake Hospital, they were able to get to the VA, and I represent the VA. Through telemedicine.
Oh, that's great. Yeah, so that's super. Sounds like some good progress. You have several programs going on now.
Mike wants to add to that a little bit.
I just kind of want to touch on that a little more. I am not a representative of our health division, however, but I do believe a lot of our telemedicine efforts involved utilizing certified nurses in the community and connecting them directly with the doctors or the healthcare providers back home. We have some other stuff that we're looking into through the MIRC initiative. Is I can't remember the name of the organization. I have their card in my car, but they're looking at using the elder care home monitoring systems, things like that. And we're looking at implementing some of their technology through the elderly waiver program that we administer. I believe that's a state program as well.
Yes, it is, yeah.
And it's actually one of the only programs that actually pays for this kind of technology. So we're looking to take advantage of that. We have 2 test units coming in here pretty soon, and then we'll pilot that out, see how well that takes off, and then look at possibly adopting some of those things for our elder community members.
Well, my experience, I'll just share with you. People will really like it. And then when you try to take it out of their home and put it in somebody else's, they won't want to give it up. So get ready. And it really helps people stay healthier.
We've already had requests to install bingo applications on the machine. But another thing I just wanted to comment on before we close up here, and that's the importance of mobile broadband.
Yes.
Dennis commented to the effect that everybody loves to check their Facebook. I do mine primarily on the cell phone. My grandma does too, unfortunately, so I get a lot of messages.
It's good that your grandma's your friend.
So she knows what I'm doing. But since the inception of the task force, I'm sure technology has changed drastically. I mean, it went on what now? 6 years?
Yeah, the first one was 6 years ago, 7 years ago.
I mean,
yeah.
So technology changes so fast. Within that 6 years, I mean, I'm sure every one of us had a flip screen. Now everybody has a touch screen. So I mean, with technology changing, that's kind of been our focus is beefing up the wireless broadband, and that was what Frank was talking about. And something I wanted to highlight on there is the public-private collaboration through the radio station. Frank didn't really touch on the fact that we worked with the A&T Corporation. AT&T actually built those towers for us in order for us to deliver the radio signal. So there was a private-public partnership that took place, which could be modeled in a number of different communities to help create that umbrella of wireless service. So I think that would be something worthwhile looking into. Another thing is reading your guys' annual reports. I noticed you guys place a heavy emphasis on right-of-way negotiations and jurisdictional issues, and I think that's something important for Leech Lake to come to the table with. Is from a self-government standpoint, I think we should definitely engage in a dialogue that relates to the right-of-ways and how the different providers across from our nation back into the state of Minnesota and vice versa. So I just wanted to comment on that.
That's terrific, and thank you, that's very helpful. It's actually one of the reasons that we did wanna come out and visit with you, is that being able to learn those government-to-government issues, what the barriers are in the government-to-government issues, as well as identifying the success stories so that they can be examples to others, so thank you. Well, we better, to keep on schedule, we better